And sometimes injections sound scary, but it kind of feels like plucking an eyebrow. So I always tell people, if you can pluck your eyebrows, you can do egg freezing or fertility treatment. The first step is typically to get some evaluation done. It typically involves ultrasound, typically around the period, and blood work to take a look at ovarian reserve and other markers of health. And I'm able to use a egg freezing calculator to really determine the chances of success. How many eggs do they need to be successful? And remember, all of the follicles on ultrasound are not going to be mature. All the mature eggs, are not necessarily going to survive the thaw. So it really takes a lot of eggs to be able to make a baby. And the younger you are, the better chance each of those eggs have. We really put together a treatment plan. And this is a protocol of medications to help their ovaries grow eggs, right? With a normal menstrual cycle, we make 1 egg a month. And with these type of treatments, we want to grow as many as we can and collect as many eggs as we can during that cycle. And it's usually really straightforward. It usually involves about 10 days of injectable medications. And sometimes injections sound scary, but it kind of feels like plucking an eyebrow. So I always tell people, if you can pluck your eyebrows, you can do egg freezing or fertility treatment. The eggs are big enough to then be what we call triggered or matured. And that trigger medication is the final step to mature the eggs. And 36 hours after that medication, we do the egg retrieval. The egg retrieval is typically done under sedation, so you don't feel anything. Usually takes about 10 to 15 minutes. It's a very quick procedure. And we use a small needle attached to an internal ultrasound. We go right through the vaginal wall into the ovary and collect all of the fluid and the eggs as well. And those eggs are then evaluated under the microscope. We typically freeze only mature eggs. And for most patients, about 75% of the eggs we get are mature. Those eggs can be cryopreserved indefinitely. There is no expiration date on them. So the progesterone oil comes in a vial of maybe like 10 milliliters of fluid. You take a small syringe, typically the starting dose, everyone's different, talk to your provider, but typically it's about a milliliter. You then will inject that fluid in your hip. Now, a lot of people will have somebody else help them with this. When I went through fertility treatment, I gave myself all of my injections, so you can do this to yourself. You go in the upper outer quadrant of sort of the hip or buttock area. So you want to be sort of up and out. And that is absolutely a place that you can reach. And those injections definitely can cause some bruising, but it's a very effective tool to help find success.